Good morning. It's Wednesday, August 17th. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Thanks for joining us on another Open Mics with Dr. Stites program. It seems like just yesterday, kids were getting out of school for the summer. What happened to summer? It went by so fast. But most area districts are already back in session. COVID has made school a whole different experience over the last few years. We're going to see how things are looking as we enter our third school year in a COVID pandemic. Joining us here in the Dolph Simons Jr. Family Broadcast Studio to talk about that are Dr. Kenny Southwick. You may remember from our program, he's back again. He's been with us before. He's the Executive Director of Cooperating School Districts of Greater Kansas City. And Dr. Jeremy Tucker, the Superintendent of Schools in the Liberty School District in Liberty, Missouri. Questions from our viewers are an important part of this program, and we want to hear from you. Get yours sent in to us now on YouTube, Facebook, Twitter, and the Medical News Network. You find links to those right here on your screen. But first, we have some important news from our colleagues at the University of Kansas Medical Center. Researchers there have just published a study in the journal Frontiers in Nutrition. It's a preeminent journal in that area. It shows a positive connection between dairy consumption and brain health in older adults. I need more brain health, so that's an important thing. Joining us live is Dr. Deb Sullivan, Chair of Dietetics and Nutrition in the KU School of Health Professions. Dr. Sullivan, good morning, and thanks for being here. Help make me start smarter. I need help with that.
All right. Well, good morning, Steve.
All right. Well, tell us why you're... Go ahead.
Well, I was going to say, so as you started to say, so we just completed a study in which we took older adults, and we defined older adults in this study as people that were 60 years and above.
Wait, Deb.
Yeah.
You said 60 and above or like 65 and above?
No, this is 60 and above.
Oh, man, I just got classified, Hawkeye, as an older adult. All right, Deb, we still love you, so go ahead, even though you've classified me now as older.
It's a harsh definition, I know.
It's tough, it's tough. You and the AARP.
Young, older.
Yeah.
That's right. So we took these older adults, if you want to call them older adults, and randomly assigned them to drink 3 glasses of milk or 3 cups of 1% milk a day, versus the other group, the control group, which continued drinking less than 1 cup of milk a day. And we were able to measure their brain glutathione, which is an antioxidant in our brains, before and after 3 months of that intervention. And in the group that got the 3 glasses of milk a day, we saw their glutathione concentration increase. And while the control group, their glutathione didn't change. And we think this is important because glutathione is the most potent antioxidant in your brains. So we think it's exciting results.
All right, so that's good. We're gonna come out. We want to let our audience know we put a QR code in the study, or to the study in the corner of the screen. Okay, so milk itself may contain an antioxidant. Now, I try to eat a lot of blueberries because those are supposed to have good antioxidants. So does it have to be milk, or can I do blueberries or other things?
Well, you can do your blueberries, and I would recommend your blueberries and other fruits and vegetables because they're all great sources of antioxidants. But the particular antioxidant that we measured was glutathione, and that antioxidant our bodies can make. While the fruits and vegetables in your blueberries, they have preformed antioxidants, so we want to eat those. Milk has that unique package of nutrients that our bodies can use to make the antioxidant glutathione. So it's got the protein, the vitamins, and minerals, and that's why we think milk has that unique package for this particular antioxidant. So the variety of your fruits and vegetables and your milk is what I would recommend.
Oh, well, okay, so these antioxidants are molecules that help fight these things called free radicals in our body. We know free radicals are like these oxygen derivatives that can go around, they can cause tissue damage. How do antioxidants control those free radicals?
So I like to describe it as think about rust on your car. So if you can all picture that, brown rust color, and that's a result of oxidative damage over time. And so we work to maintain our cars to prevent that rust. It's the same thing with our bodies. Those antioxidants that we get from fruits and vegetables, or the nutrients from milk, can make those antioxidants. That helps our body fight against those free radicals. It prevents that oxidative damage. So just like you maintain your car, you need to maintain your body with antioxidants.
I think my CF team probably thinks I have a little brain rust, so this is important here. So if we think about that, blueberries and the stuff, those contain antioxidants, but they got to get through our gut system, our epithelium, and through the liver, and get into the right spot in the body. With this milk idea, it looks like you're actually stimulating the body's own ability to have glutathione, and you increase glutathione in brain. That's a pretty big deal.
It is a great deal. And, we are uniquely situated at the Med Center that we do have the researchers at Hoagland Brain Imaging Center that can measure that.
Yeah, so what kind of milk are we talking about? Does that have to be cow's milk, can oat milk, or almond milk, or soy milk? Can it get us there too?
So we used cow's milk, and we used 1% cow's milk and 3 cups a day. And we chose the 3 cups a day because that's the dietary guidelines for Americans recommend 3 servings of dairy a day. And because, we use the milk, I can't answer whether the other products would have that.
Okay, well, that's so those of us who may be a little lactase intolerant, that means we're going to have more brain rust.
Not necessarily. So if you have the lactose intolerance, you could use the lactose-free milks.
Yeah, and that should get us there too.
They've got the same nutrients. Nice. Yeah.
All right, well, that's very cool. And so hopefully we can get some of these other, maybe we can find out, is the things that are in dairy milk, are they in other types of milk?
So yes and no. So most of those other types of milks are fortified with the vitamins and minerals, and they have protein, but very likely maybe not the same unique contribution of nutrients of the proteins, because the particular milk is really high in the amino acid cysteine, and we think that's probably the key amino acid that would be found in milk that may not be in the other milks. But we have to do the research in the future to decide that.
All right, well, this is exciting. So I'm delighted that you were with us on the program, Dr. Sullivan. Thank you. Congratulations on this publication. And again, thanks for joining us. We'll look forward to hearing more from you soon, and keep up the good work.
All right, well, thanks for having me, Steve.
All right. From news about older adults, apparently like me, to news about our kids, COVID has made school a lot different the last 2 years. It would be so good to get back to normal. So what about this fall? In brand new guidelines, the Centers for Disease Control and Prevention has adjusted measures on social distancing and quarantine. And we've been talking about this on the MMU and last week on Open Mics. The focus is now on reducing severe illness. And that's a pretty clear transition the CDC has been making over the last 6 to 12 months, where they talk about whether you should have masks on, the zone of your county, et cetera. It's all been about how do we reduce severe illness, because COVID is here with us for a very long time. The CDC no longer suggests staying 6 feet apart from other people. It also says that contact tracing and regular testing should be limited to high-risk settings such as hospitals, nursing homes, and prisons. And the new guidance does not require quarantining for those who've been exposed to COVID. That's a big deal. As long as they're not infected, they don't have symptoms. This is just one change that might affect schools this fall. Dr. Southwick, your group works with 32 school districts here in the metropolitan area and in the region. How do you feel about schools not being included in the new CDC guidelines? What does that mean to you?
Well, over the last 3 years, school districts in each of our communities have pivoted when they needed to pivot, and they've listened to people in their community. I think the guidelines and the direction that we have right now, we're going to live with COVID. I heard the other day that as long as there's humans on the planet, we'll probably have COVID. I don't know whether that's true or not, but we're going to live with it. We're back in school where we wanted to be from the day we left. And I think we're a little smarter as a result of a lot of the work that you all have done here and medical advisors across the area. We're a little bit better equipped to meet this task. We've got to get back to instruction and learning again, and we'll see what the year brings us.
So it's got to be a little bit of relief thinking I don't have to do contact tracing for everybody anymore, and we're not going to quarantine a lot of folks. It may put you a little bit more at risk for spreading COVID in the schools. How do you think? What do you think about that balance?
Well, originally our counties did the contact tracing for us, and then their inability to do that, the individual school districts picked that up. I brought with me Dr. Tucker today, and he's actually the expert in the field. He's the general on the ground, and I know they have I think last night, have put their plan in place, and I know he'll be able to talk about that a little bit with us this morning.
Dr. Tucker, as superintendent of schools in Liberty School District, do you worry about staffing this year due to viruses? What's your plan look like?
Sure.
How are we
Yeah,
gonna do?
absolutely. Staffing is always a concern for us, just as we navigate workforce needs and then add COVID to the mix, right? So in our district, we've extended COVID leave as we enter the fall semester. We have a great partnership with our local medical providers, health departments, who do a lot of the legwork for us as far as syndromic surveillance, but then at the same time, being able to coordinate as far as their recommendations, their plans moving forward. So we will monitor our staffing levels over the course of this year as we start the 22-23 school year, just as we've done the last couple years, and then make adjustments with the advice from our medical experts.
So I want to bring up I can't say the word, graphic that shows the CDC saying you should wear a mask up to 10 days if you've had COVID. Are the schools going to be encouraging masking?
So just as we've done from the very beginning, following the guidance of our two health departments, that being Clay County Public Health Center and then the Kansas City Health Department. Currently that guidance speaks to masks being recommended. And so in our return to learn plan that was mentioned last night, certainly optional for our students and staff, but then again continue to adjust as things change in our community. If we see an uptick in cases within our schools or staffing levels, we would certainly communicate that out, both in messaging, but then also on our COVID-19 dashboards.
You know, it's interesting, we were talking a little bit before the program started. Hawk and I know we both get up in the mornings and read before we come on the program, and I was looking in New York City, an article about them today about how they are approaching COVID so differently, and it's kind of a little bit more back to normal, and it feels like the same guidelines you guys have in place.
A lot of similarities. The important caution, though, is that no two districts are alike, and as you all know, no two regions are alike across our country. And so it's been interesting over these last couple of years to watch what plays out, you know, east of us or west of us, that then eventually we can ready for. Sometimes it starts here in the Midwest with the epicenter, and then it kind of grows from there, as we've seen with the virus and kind of its evolution. But yeah, districts are in a lot of similar places, but then the two years prior, districts navigated that very differently, where some, you know, did not return to in-person learning for some time, whereas others got back to it pretty quickly or had kind of a hybrid approach to learning.
Yeah, I think if I remember, Springfield was the outbreak for Missouri was kind of the outbreak of the Delta virus. You just watched it spread along highways before. Well, now that COVID vaccines are available for all school-age kids, let me talk to both of you about this. Would you like to see COVID vaccine included in required vaccinations?
You're not holding back, are you?
No, I'm not. I knew that question was going to be a hot
That is an important question, and certainly left to others beyond kind of my sphere of influence. What we've communicated to families is that it's available first and foremost, and that's a very personal decision, a family choice, a family decision. We do know the effects of the vaccine and how it's been able to curb the spread, but then also how people experience the symptoms related to COVID-19. So we're communicating and messaging opportunities to get the vaccine, any changes that come about. But that certainly is something left to health departments as they determine, you know, what gets folded into those annual requirements when it comes to children's vaccinations.
Yeah, and maybe we'll get a moment here where we're going to talk a little bit more about some children vaccination and polio and questions about that. But we're hearing a lot about staff shortages as schools start. Dr. Tucker, you concerned up in Liberty?
Yeah, certainly. We've been busy all summer. People think the summer is quiet, but the summers typically are very busy getting ready for back to school. And one of the tasks of our Human Resources Department has been to continue to meet vacancies, both on the classified side, our support staff, but then also certificated. And again, each different district is slightly different as far as their applicant pool. We are fortunate to say today that we are fully staffed as we think about the 22-23 school year when it comes to our classroom teachers. Support staff is a cyclical thing that we navigate over the course of the school year. So we know that'll be a challenge moving forward for us, but something we're committed to making sure that we have quality teachers in classrooms.
Dr. Southwick, hearing that regionally too?
Yeah, I think we see it regionally. We're seeing it nationwide. Some recent surveying talked about satisfaction and whether or not teachers would recommend young adults going into the field. It's at about 70%. And so I think we're in a time, COVID was rough on schools, rough on parents, rough on children, but our teachers particularly, whether they were doing that in Zoom or in the classroom, it was a tough job. And I think we're at a time where we need to examine the cultures we have in our buildings and in our school districts. We need to make sure that our staff knows that we're working to support them. that when they have concerns, they can come to us and try to get back to a point in time with our communities where there's been some civil unrest about masking and vaccinations and those kind of things. Getting back to a time where our teaching staff and our support staff are honored and held to a high level of respect. So we've got some work to do. It's still the best system, I think, on the planet, and we just have to work every day to try to make it a little bit better.
You know, I think that makes sense. I think you mentioned the trauma, and I think teachers were oftentimes in the center of this political maelstrom and really took a lot of injury, really, both moral and mental perhaps. And I think that injury is a result of seeing what kids needed and seeing what healthcare was and hearing all the political rancor around it and getting caught in the middle. And I think our nursing staff had the same experience. They were often at the front lines, and then patients would come in demanding therapies we didn't know worked, and we're then trying to communicate with patients and families and, you know, death and dying, and trying to do everything on Zoom or whatever. And those are hard struggles, right? It upended a life, it upended your expectations, so much of what you're there for, and suddenly you're thrust into an entirely different role. I bet that's affected the teacher population just like it has in nursing.
Yeah, I think that's exactly it. And we just saw in an outcry, the whole issue became political, whether you were in school or out of school or hybrid or Zoom or whether you were requiring masks. It just became political when it's sad. I don't think it needed to be that. But we're going to continue, as I said, to work, figure out where we are, like Dr. Tucker explained. They've got their plan in place. They're going to work their plan, and if they need to make adjustments, they will. That's similar to all of our school districts as we move into this third year of COVID.
The independent school district is tossing around a 4-day school week where I go fly fishing in Newcastle. Colorado has a 4-day school week. What do you guys think?
You know, I think from what I've gathered, they're in the process of studying that approach. And so I know they'll engage with their community and have some rich conversations, I'm sure, about the topic. What we've seen in Missouri is I believe there's around 27% of our 550 some districts in Missouri that have moved to a 4-day week. However, the majority of those districts are small rural communities. And so what may work for them may or may not work in a suburban or in an urban community setting. I think the importance of exploring and having the conversation could lead to other solutions. It's a matter of elevating what the issues are, talking about those needs. Is the 4-day option the best solution, or are there other solutions in meeting workforce and staffing issues that all of our districts are experiencing?
Yeah, it's approximately a big deal. We know many of you have questions. Let's head to Studio B with Alexis Del Cid. Good morning.
Good morning. You know, the topic of moving to a 4-day school week has hit a nerve with some parents. Maggie just wrote in. She wants to know, what about parents in the independent school district who might now have to find childcare for that 1 day off each week?
Yeah, because that has to be part of the big conversation.
That's rough.
Yeah, I think for even those districts that have adopted a 4-day week, be it in Colorado or Missouri or Kansas, you do have to answer that question inevitably as far as childcare on that 5th day, be it a Monday or Friday or whatever time of the week. Another opportunity is for real-world learning experiences for districts that might be able to leverage that time for experiences in the workplace, be it through internships or online courses or dual credit opportunities. So I think districts that have gone that path have to be creative. The interesting thing to note is those districts that have moved toward a 4-day week actually don't lessen the number of contact or instructional hours with students. They just accommodate for that during a 4-day window as compared to a 5-day window. But I know at the top of parents' minds is, what do we do on day 5? Whether it's coming up with a babysitter or alternative program, districts are certainly going to have to look at that.
So it's like 4 10-hour days instead of 4 8-hour days.
It can make for a long day,
yeah,
for sure.
It does.
I would add to that, we just heard from a doctor about nutrition. You know, one of the important things that we provide and have for years is feeding our children. And we know when we first moved into COVID, that was our biggest, we had no idea we would be 3 years into it. We figured out how we would feed our kids. We did that by taking lunches on buses and doing all kinds of things, opening centers and with all the precautions. I think that each individual community will have to look at their data, have to listen to input. Really is not, I don't think, about saving money, I'm not sure if everybody does it, it becomes an enticement to keep staff. But I think we've got to look at critical issues around instruction and learning and making sure that when we've got districts that are 80 and 90% free and reduced lunch, we've got to feed them. And a lot of times we send backpacks home and feed them 7 days a week. So those are all things that individual districts are going to have to look at very closely.
Danny has a question. Danny wants to know, and this is on a lot of parents' minds, with talk of another fall and winter COVID surge, are we going to have to go back to at-home learning?
So are we back, if we need to flex and pivot, can we do it?
I sure hope we don't have to.
Yeah.
But one thing that I want to commend our staff and teachers and administrators across the country for doing is they can do difficult things. We've proven that over the course of the last couple of years. At-home learning or virtual learning has been a byproduct of this experience where we know it works for some, but not for all. And so we still have those options in place for families where that might be the best learning scenario for them. I don't anticipate us having to go back to at-home learning. Of course, as soon as I say that, something will happen. But we certainly will keep that as a scenario moving forward. And in the event we need to pivot, we certainly could pivot. But I would anticipate if that ended up being the case, things would have to be fairly severe for us to make that decision in Liberty Public Schools.
Yeah, and I think what we know is that we're going to hope that another fall and winter surge doesn't come. But I think we probably are setting ourselves up for one. I'm going to guess late fall, early winter. Alexis, any other questions? Oh,
You want to check in with Dr. Hawkinson, though, first,
Yep.
and then we'll get to those.
All right. Doc Hawk, how are we doing out there, brother?
Yeah, hey. We're still holding in that low 20s for active infections. 23 active infections, 4 in the ICU, 2 on the ventilator, 24 in that recovery period. But Steve, I think it's good news when you look at such as the graphs like in the Washington Post. We have really started to see a decline in the overall reported cases and hospitalizations as well. So I think we are moving in that right direction.
Yeah, there were some good discussions about that. UK has now become the first country to approve the new Moderna COVID booster. We call it bivalent because that's the vaccine for two things. What do you know about the effectiveness? What do you think?
So I think that those are good questions. From what I understand, this is the original Omicron variant or isolate. What we know that in the United States they have recommended, the FDA has recommended a BA4 or BA5 component instead of the regular Omicron. I think overall it still remains unclear exactly what is the full clinical benefit of adding in this new spike. We know certainly the world has moved on from the original Omicron, but we also know that the T cell components, those areas of the spike that our T cells recognize really to help prevent severe disease and hospitalization really have not changed. So I really want proof in the clinical benefit or effectiveness of that. But the leading reasoning from the FDA and that group that has said, let's put in a second spike is because there probably is no downside, no down effects of that, no safety issues, but there could be benefits. And I think we really just want to wait and see what the clinical benefits of that is.
So it sounds like they're moving forward. In the U.S., I think both Moderna and Pfizer have been at least gotten an EUA for going forward with their bivalent vaccine. And we expect that, I think, in late September, mid to late September now. And I don't, do you know if the other vaccine will even be available then, or is it only going to be the bivalent?
So the original
boosters?
vaccine will still be available for those initial vaccines, those initial vaccine series. As far as the boosters, we will be using this new bivalent vaccine from what I understand, but I don't believe for the original vaccine series that they are going to go to the bivalent vaccine. It will still be that original like Wuhan ancestral isolate from what I understand, but we'll wait and see what happens when the full recommendations are made and they roll out those vaccines.
A new study out of the University of Texas finds only about half of parents are open to vaccinating their children against COVID-19. How do you think concerning that is as students head back to school that fall, and we may open that up to our broader audience too? Hawk, I'll start with you.
Yeah, I mean, for me, again, an extreme proponent of vaccine for children, especially in those school settings, those daycare settings. We know the good, we know really the risks are extremely minimal. So it is quite concerning for sure. And we continue to learn more and more every day about the effects of the infection on children versus vaccine. And we know that vaccines cut down on those unwanted effects from the infection. So I think it's important to continue to vaccinate children, get those young children vaccinated. We know they can have complications as well.
All right, Team School, what do you think?
You know, I think you've seen the evolution of accurate information, and it seems, at least on my end, where we've moved beyond misinformation to more accurate information. And that is communicated through a variety of partnerships, from our medical experts through our health services departments and schools. And I think just as much as we can continue to do that for families, they're going to be better equipped and educated. And at the same time, it's being able to provide information about where I can go and get a vaccine if I'm interested in doing that for my children, my family. So I think just a continuation of that. As things evolve, how are we getting information out to families to educate and inform?
Yeah,
Yeah, and I would say there's years that we actually pull together vaccine clinics. This is the time of year when parents go to get their child vaccinated so that they can meet the requirements to be able to come to school. There are certain exclusions, but by and large our kids are vaccinated, and it's been accepted. I don't think we're at a point in time, at least in Missouri, where you're going to see that mandate for COVID vaccine to be included in that protocol of vaccines. But we may get there. But the thing that I would say is, and from listening to some of your shows, we know that the people that are in the hospital right now, by and large, are the ones that are severe that aren't vaccinated.
right. If they've been vaccinated and boosted, they really don't land in the ICU.
Yeah, and I think that's what we do in terms of keeping kids in school and not disrupting the families. My advice, and I've said this to you guys before, and is that I would encourage all of the parents to get with their physicians to talk about vaccines. Look at the mandated ones, but look at the other ones that are out there right now, and make those decisions based on good information and not something we might read over the internet in one of the dark pages of the internet.
Yeah, that's no, internet science isn't really science, is it? You know, I think the thing I'm concerned, we hear about polio being back in New York City, Hawkeye, and the wastewater, and then you think about people deciding they don't want to have polio vaccination. These are folks who haven't seen.
No.
You know, I'm old enough. We were talking before the show. Dr. talking with you too, because you had an experience in your life. You've seen the impact of polio in population, and whether it's a knee brace and the ability to do sports, or you know, you have trouble feeding yourself, or you can't breathe, or every time you get a cold you can't breathe, or you die from it. Polio, I mean, there's not therapy. Once you get it, the only therapy is to try and survive it, and that requires respiratory support. This is not a disease you want to get, and it's not anything to trifle with, and it's certainly nothing to make up fiction about data-wise. So polio vaccine, safe and effective. Hawk, or
You know, I think it goes back to districts having policies in place around navigating infectious diseases. And so we've had those in place prior to COVID, and from time to time would have to navigate those, whether it's measles or something else. And so getting back to practices and processes in place that we've had for some time, and then adjusting as new diseases arise or resurface in the case of polio. It's not just something that you read in a history book. Now you're reading it in the headlines as far as news and what's going on nationally. So how do we continue to provide that information, but then also lean on experts? I think that's an area where we're all wanting to get back to, is building and regaining that trust among our communities with our health professionals, and as well as our educators, because some of that's been eroded over the course of these last couple of years.
Dr. Hawk, let's get an update now on monkeypox in the U.S., the next plague. Hopefully nothing like COVID, though.
Yeah, so monkeypox, again, still quite a few cases, increasing cases, over 12,000 cases right now. And we have some, of course, 24 in Missouri, 3 in Kansas. Right now here at the health system, we have so far vaccinated 38 people, and we have our vaccine clinics opened up for that to really focus and get those highest risk people vaccinated. We also heard that the Health and Human Services Biden administration is releasing 400,000 more doses as well. So this is a big push now to be able to get this infection, this outbreak stopped as soon as possible. So I think that's other good news, is that the vaccine is becoming more available. We certainly have some here. There's more allocations to states, and I think that's only a positive thing.
one monkeypox headline. The first suspected case of human to dog transmission of monkeypox has been reported in Paris, leading the Center for Disease Control and Prevention to update its website to include dogs amongst animals susceptible to catching the virus.
I think this is certainly within the realm. This is what we know. It is called monkeypox. However, it should be more of a rodent pox because that is really the host of this virus. Humans, monkeys, dogs, those are otherwise incidental hosts. So I think it's very important to understand that. Just as we saw coronavirus, infect other animals, other species as well. This is extremely important. We really do not want this virus to take a hold here in the U.S. by being able to infect either household or other wild type animals, such as occurs naturally in Africa where the virus is from. So I think it's vitally important to understand that, and if you have it, really take those precautions to help prevent anybody in your house or any other household animals to not get this disease.
Yeah, and I think interesting headline today about people going around the world shooting monkeys now because of monkeypox, but the reality is it's just another animal reservoir, and there are a lot of animal reservoirs for all sorts of viruses, and we can't blame a single type of animal for anything like that. All right, back to our discussion on COVID in schools as another fall term has us. With us are Dr. Kenny Southwick, Executive Director of the Cooperating School Districts of the Greater Kansas City, and Dr. Jeremy Tucker, Superintendent of Schools in Liberty. Talk about some of the long-term effects on kids who have spent the last 2 years at home learning. Has COVID had those kids fall behind, guys?
I think there are certainly learning gaps that have been experienced as compared to being seated and fully face-to-face. The important thing to note is, what grabs the headlines is 2 years of at-home learning, when in reality many of our schools continued face-to-face. I know at our elementary level we were 5 days face-to-face with appropriate accommodations made to continue to learn. Our secondary level was hybrid for the majority of that time period. Not entirely the same as seated instruction, but that's what we're working on now, is how do we shore up some of those learning gaps. The other thing we talk about in Liberty Public Schools is learning gains, and that there have been learning gains for all of us, whether we're children or adults, and those skills that we've had to, out of necessity, kind of grow in, whether it's collaborative or being problem solvers or being critical thinkers, that COVID brought upon us. And so to students' credits and adults' credit, there's a lot of learning that's been gained over the course of COVID-19, just as with any traumatic experience that we certainly want to elevate and we want to recognize as well.
On September 6th, the Blue Valley School District with the University of Kansas Health System is hosting the largest mental health in-service in the nation for teachers and staff. They're developing a plan for student mental health needs during the school day. The CDC says the number of kids turning to their local emergency room to seek help for their mental health has doubled in the last 2 years. The question is it surprising that we are having to address mental health as an emergency in schools? I'm guessing not. Thoughts?
Yeah, no surprise at all. And in fact, I'm grateful that it's been elevated to the attention that it has received. I think there are instances of students needing mental health supports, but at the same time, it's something that we've known for a long time has existed in schools. So learning about the work that Blue Valley is doing, commend them for tackling that head on, along with other districts. I know in the state of Missouri, we're fortunate in Clay County to have a Children's Services Fund, which our taxpayers approved a couple of years ago, and it generates about $3.5 million per year for us to be able to focus specifically on the mental health needs of our students, be it individual counseling or family therapy, whatever the case may be. Without that, we would be in a world of hurt as far as trying to continue to meet the growing needs of our students in terms of mental health.
So, go ahead.
And I would add to that, Jackson County has an issue that'll come up on the ballot that will bring tax dollars to provide support to individual school districts, either in their district for support people or contract. That's very important that we renew that. They actually are asking for a little bit of an increase. But I think COVID has brought a highlight, and obviously the shootings across the country have brought a highlight to mental health. But I served about 12 years as a guidance counselor, and learned early on that guidance was missiles and counseling was for people, and that our students need support and our families need support. But it's been kind of an ancillary service and not as important. And when things got tight with dollars, those services went away. We're at a point in time where just trying to work with our students to learn, making sure they're fed, make sure they've got their shots, make sure they're transported to school. We have to focus on their mental health to be able to make sure that we have kids prepared for the future. So, I'm not surprised of the uptick, but the concern could lead to good, and that is that there'll finally be some additional funding for services for our schools.
One of the things in the outcome of the pandemic may be that things have become so real. I think hopefully science has taken, after having taken a little bit of a beating in the middle of it, maybe people are starting to recognize the importance of the things we're doing, the things that we're trying to do. Along with addressing mental health issues, students are having to do active shooter drills. It's a terrible thing to have to say out loud. We've already seen 27 shootings in the U.S. from January to May this year, including the one at Olathe East High School. How do these drills help schools feel safer? Does it add stress? Can you really make a difference? What do you think?
I think it's all about preparedness and readiness in the event that you do have a situation that arises in a school setting. And so part of the practicing piece is similar to a tornado drill or a fire drill or any of those other preparedness areas that we get ready for in the event of a situation. It certainly does cause stress. Each person responds a little bit differently, but at the same time, you have to continue to educate staff as well as students on how to go about that. Something we're doing in Liberty Public Schools this year for the first time at an idea from a parent group is to create some information on how to talk to your children about school safety. Because even a young kindergartner may have questions as they start the school year. And so we've put together some tools to be able to assess and help kids, families at the kindergarten through 5th grade level, the middle level, as well as the high school level, to equip parents on how best to talk with their students in an effort to ensure they know they're safe, but more importantly, to try to minimize that stress that may be caused for both parents and children.
So it's tough when you have to think about those kind of things when you think about schools and having to think about active shooters. That's man's inhumanity to man. Alexis, are there reporter or other community questions today?
Valencia has a question, and she writes, aren't we producing a worse variant with these new guidelines?
We didn't catch the first part of your question. I'm sorry, we didn't hear you. Try again.
Tanya writes, are we producing a worse variant with these new guidelines?
I think she's talking about the COVID variants because we may be passing them along a little more rapidly. But the reality is, Hawkeye, there's such widespread community transmission. I don't think the guidelines are going to really impact that. What do you think?
Yeah, no, I would agree with you. I think what we have seen is, what we believe is that really the evidence of new variants really probably comes from those immunocompromised people, immunosuppressed people, where they have prolonged viral replication going on and that it is able to take hold. But that isn't the only way. We know that this virus does change or mutate, if you will, just by replication. And then what happens is, just like any virus, it just fills in a void where it is able to spread to one person or another because of lack of immunity. In this case, we're talking really about immunity from antibodies. But is there a worse variant? I mean, so far we really haven't seen that, Steve. Yes, there was probably a little bit more risk of severity with Delta, but really all the other variants from the ancestral Wuhan isolate on have really been similar and have had similar risks of going to the hospital and death. But what we have now, again, is prevention methods such as vaccination. Also, I think more information for people understanding their risks and understanding what to do. And if they don't feel comfortable in a situation, stay out of that situation or wear a mask if you want as well. And then, of course, it's early testing and Paxlovid. So I think that's a good, insightful question, but I don't think we're going to be seeing that from this new change in guidance.
And remembering that the reality is that most people around had not been masking for a long time, so I don't think it's changed that. And you have to think about the entire world, not just the United States around the question.
Jean has a question that piggybacks on this topic. Jean wants to know if these new guidelines are ignoring the long-term health effects of having and surviving COVID.
So I think, again, a question sort of about long COVID and whether or not if we transmit more often because we're not quarantining anymore and we may not be masking, we're taking the 6-foot distance away, that we have enhanced some more long COVID. And that could be true. But I think this is a public health balancing act, which it always is in the public health. And what we're saying is that the need, and we've talked about it already in this program from mental health aspects of kids and other things, the need to have a little more and more of a normal sense and pace of life has to be balanced against COVID-19. And I think, Hawk, what we're saying is if you get vaccinated, you're a lot safer. If there are Paxlovid, there's other therapies. The death rates are down, hospitalizations are down. This most recent variant is probably the B5 is probably the most transmissible variant yet we didn't have anywhere near the overwhelming surge we had last fall. And I think a lot of that is due to vaccination as well as disease transmission that's already occurred.
Yeah, I agree with you, especially that initial statement about it's all about balances. And again, remember the guidance is, first of all, know your own risk. Know your risk of severe disease, first of all. We know that there are inherent risks of complications with infection and reinfection as well, such as long COVID and other problems that can be prolonged, such as heart, lung, kidney effects as well. Then the next part is being up to date with vaccination, and it really kind of is focusing down on that individual health at this point in time. They're very good questions, but just as you said, Steve, there are a lot of balances, a lot of independent variables to take into account for these new guidance measures.
Yen Liang has a question about the BA5 variant. Yen writes, compared to previous variants, is it more likely that BA5 would attack our lungs? And what are the clinical symptoms of BA5?
The BA5 presents more and more like a common cold, and so we're seeing lung disease, but we're still seeing systemic disease with it. And I think that I think it's much more similar, Hawk, to prior variants than it is different.
Yeah, I think that's right, and I think it was in Omicron as well, where they kind of noticed some signals, data signals about really more infection of the upper respiratory tract, less tropism or less likely to be in the lungs. Now, of course, we know that it can be, and those people with severe disease who are on the ventilator, obviously it's affecting the lungs as well. So, but to your point, I think it's really similar, but maybe Omicron, maybe this variant and these sublineages have less propensity to go to the lower respiratory tract, i.e. the lungs, and more of that upper respiratory tract, but there is always that risk.
Yeah, and at the end of the day, it's a coronavirus, and coronaviruses tend to go and pry open cells from different techniques, and the ones they can get to most easily are those in the upper respiratory tract because you have to breathe every day.
Isaac has a question. Isaac wants to know, once the new vaccines become available, and I'm paraphrasing, it's a long question, but he would like to know, how do you know what formula you're getting, and if you're getting one of the new vaccines when you make your appointment with CVS or Walgreens?
We hit that earlier today. We don't. Yeah. I don't think it's clear yet which booster people are going to be offered, or what's actually going to be stocked in different places. I think most places are going to move to the bivalent booster, meaning it's got the combination, not the single one. I know that's the one we'll be getting here. And so as you look at that, you think, okay, that's probably the one you'll most likely get. But I don't know right now if you can choose to get the older booster versus the new booster. I don't know if Moderna and Pfizer are going to be making supplies of the old booster.
Yeah, I would agree. I think it's really going to shift to that new bivalent for those boosters. Again, from what I understand, for a primary series, so that first two, or if you're immune compromised, for the first three, you will still be getting that original. But again, things could change once the recommendations do come out. I think we're hoping for those in the next 2 to 4 weeks, maybe.
Yeah, I think we'll see a lot more information about it. And just in my own practice, I see a lot of patients post-lung transplant, immunocompromised. And I've been saying to them, they've asked me, should I go get a booster? I say, you know what, I think I would just wait for the bivalent booster at this point because the timing works out for you. You can wait till another few weeks for September. But also remember that bivalent vaccinations are not new. The influenza is a tri or quadrivalent vaccine. I mean, there are all sorts of vaccines out there that have more than one formulation of it in there. So it's not a new thing. So I don't think it's anything to be afraid of.
And more than one vaccine that has different protection values for different organisms, not just coronavirus, but obviously like the Tdap vaccine. There's a hepatitis A and hepatitis B combined vaccine. So there's measles, mumps, rubella vaccine. So having multiple components in a vaccine is not new or unusual.
And actually it would be no different than getting 2 vaccinations on the same day, right? Because we've even said you can go get your influenza and your coronavirus vaccine at the same time. It may not feel very good the next couple of days, but you can get them at the same time. That's not really much different than having 2 different types of strains inside a vaccine.
think I have about 4 more questions, so I'm going to try to do a lightning round, which is hard to do with such a smart panel. Joellen
I think
wants
she just
to
said
know.
we talk too much.
No, no,
Okay,
no.
go ahead.
You
Yeah, that's
have
what
a
she
lot
said,
of-
Alexis. I heard
Wrap it
it.
up.
You know, get the brain
getting
rust.
the
I got the
time
brain
cues.
rust, but I can figure out what you're saying.
I'm getting the time cues. Okay, Joellen wants to
3 more
know,
minutes.
what do you think it would take to get a yearly COVID vaccine updated every year, just like the flu?
I think right now we're kind of settling into an every 6-month pattern if you're immunocompromised. We may get to every year. We just have to see what the data shows.
Yeah, I think it really is following the data. You know, what are the downfalls of every 6 months? What are the downfalls of prolonging it out to a year? What is the circulating variant? Not necessarily that doesn't have much of an impact, because again, I think we need to go back from what we have seen so far throughout all the variants. If you are up to date with your vaccination, and we saw Dr. Southwick just talked about this, if you're up to date in your vaccination, you are likely going to be as protected as possible from having that hospitalization and severe disease. So I think we're still doing pretty good. I'm not sure how much the new variants are going to play into that, but we'll wait. We have to wait and see for that.
Gretchen has a question about monkeypox. She wants to know if monkeypox can spread in swimming pools or during school sports, which goes right along with Marie's question, which is, are school sports going to get back to normal? With this new school year, there are going to be more precautions in place, whether it be monkeypox or for COVID.
Yeah, swimming pool, not so much, right? The water, but the sports.
Certainly on the spread, we can talk about that. So first of all, monkeypox, really the main way that you are going to be getting it is going to be that close skin-to-skin contact for some prolonged period of time. Now, can it be spread on a respiratory secretions from your upper respiratory tract? Yes, that is less likely. Dr. Stites has talked about that. Can it be spread on inanimate objects or indirect ways, such as fomites or things like table surfaces? There was a recent publication out of MMWR, I think just today or yesterday, that showed that it is probably less likely to happen on those flat, hard surfaces like tables, desks, doorknobs, things like that. It's certainly, we know it can be in clothing and bedding, and so if you have somebody sharing clothing or bedding, that is more likely. But these are all less likely than that close, intimate contact. Now, if you have certain sports like wrestling, we know there is significant contact there. Certainly it can spread that way. So we have to watch out for that. But for the general school-going people, it is going to be less likely that will happen in that way. Certainly if you have a virus and you're scratching or itching some of the pustules, if you happen to have them and don't understand it, and you shake hands or touch somebody else and then they are touching on their face, their eyes, their nose, their mouth, they can certainly get it that way. And that's why we go back to what Dr. Stites always says, the pillars of public health. Hand hygiene is so important. So those casual contact ways, it is going to be less likely than the other more intimate, close skin-to-skin contact. But I think we do need to take care and watch out for those certain sports like wrestling, where we know people can be touching quite a bit during that activity.
Wrestling
forward.
and football. So, Dr. Tucker, are you guys taking precautions with that, even instructing the coaches? If somebody's got a rash, don't play.
Yes, similarly to how we navigate staph infection with wrestling, especially clearing things down, making sure we know where kids are at as far as health conditions, and then appropriate precautions along the way.
And it does work. It's just like masking for COVID. In this case, if you got pustules, don't play, don't go around to other people, don't be in intimate contact.
I have one bit of housekeeping for our viewers. We are getting a handful of questions as well about that super interesting study that you all talked about with Dr. Sullivan at the top of the program on dairy and brain health. So for people who want more information on that, we had a QR code, but if you're listening to this as a podcast, I want to give you the bit.ly link. It's bit.ly/dairy and brain health. So that's where you can get more information, and we'll try to get your questions as well to Dr.
We probably need to get her
Sullivan.
back on the program, Alexis, because I want to know about ice cream. I forgot. I meant to ask about ice cream today, and it just left it left my mind, which probably means I need to eat more of it.
I think that's, if the Dr. Stites, if you say we need to eat more ice cream, then I think we need to take that.
No, I'm not saying that yet, but I'm hoping that that's the answer to the question.
Right. And we have lots of questions. As far, vegans are wanting to know if this applies to them. One more question from Isaac. No, let's go with Kay. Isaac, I already got you. Isaac always has great questions,
Yeah,
but
yeah.
Isaac
Kay,
does.
he's got many. We love Isaac. Kay came in though with this. It's a good question. Kay writes, she's in her 70s. She writes, I had the polio shot many years ago. Do I need another polio shot?
Oh, great shot.
Yeah.
Great question. Fortunately, polio stays with us a very long time in that shot.
Yeah, and you probably had the oral polio vaccine. So oral polio vaccine was stopped being in use in the United States in 2000. We know that that is better for helping prevent gut infection for sure. You should still have protection if you are vaccinated at all. And so I think that is a good question. I would certainly like to deep dive further into the polio, what is going on right now. But I think just to our guests, what they have talked about, and I think we cannot endorse this enough and repeat it enough. Please get your children vaccinated for those vaccines, for those vaccine preventable diseases and those mandatory vaccines. This will prevent your child or someone you love from having that poliomyelitis paralysis, and I think that's extremely important at this
Vaccines
point
are
in time.
safe, they're effective, they do not contain microchips, and they actually work as they have for now 50 years at helping to prevent severe disease and death. And you know, don't believe the internet science and all the flapjacking out there about people who think otherwise. Alexis, any other last questions before we turn to final thoughts?
Guys, I've been cut off. The producers
Oh, you've been cut off.
Smoke is going to start coming out of Mike's ears if I keep asking questions.
I know, he
I've gotta
does, he
stop.
does, it does.
But
He
we have-
probably
we
has
have
a little bit of, he
We have
just
a
needs
great
a little more
discussion
milk.
going on.
He needs more milk.
More ice cream.
Oh, that's it. All right, Dr. Southwick, final thoughts for us.
Yeah, I just want to thank Dr. Tucker for coming. I called and he jumped on, and he's a wealth of knowledge and is considered an expert in the job that he does, and I have a lot of trust and respect for him. I also would be remiss if I didn't thank you, Dr. Stites and Dr. Hawkinson, for the work that you did to help us navigate the last couple of years. It was very impactful. It's nice to be here in 3D this morning.
Yeah,
First
it's
time
good.
I've been in
Great,
the
yeah.
studio. I've been Zoom for all of our other meetings, but I wanted to thank you. I recently attended a Mark luncheon where you were honored as being a leader in the area, and I want to congratulate you for that, and from the bottom of my heart, let you know how much respect and appreciation that I have and our school districts have for the work that you've done. And we're not bashful. When we need something, we're going to call.
Well, please do call and thank you, but it always takes a team. You know, Hawkeye and I have been working on this. Alexis, Jill, Jess, Logan, Anthony, the whole studio back here. Everybody does a great job, and without the commitment of the health system, it couldn't have happened. And you know, we're native Kansas Cityans. This is my home, and we want to do all that we can to help support that. Dr. Tucker, final thoughts.
Yeah, just to echo what Dr. Southwick shared, I know all of our districts are grateful to KU Med, to you, Dr. Stites, and all of our medical partners over the last couple of years for everything that they have done. We've come together, we've collaborated, we've commiserated from time to time as well. As much as we have been through, I want to end with this. There is a tremendous amount of excitement among our faculty and our staff about the start of the 22-23 school year. We're both in the business of people. Ours happen to be a little bit younger, but we're incredibly excited to come alongside kids and families and elevate them and grow them both academically, but then in their mental health capacities. And we certainly cannot do that alone. So we look forward to collaborating with families in our entire community on behalf of all the children that we serve in the Kansas City area.
Thank you, and thanks for all the great work that you guys have done taking care of those kids. That's the day after tomorrow is when those children grow up and become our leaders. So we so appreciate the great work you guys have done in keeping our kids safe and making sure our schools did as best they could, whether they had to do hybrid learning or at home learning, but now back and forth and doing the 3D thing. What fun is that? Hawk?
Yeah, I just want to thank our guests and all the administrators and leaders out there because we know how important schools are for everybody, how important the counselors are, the teachers, the administrators. And comrades in education for keeping that going. Even my father was a teacher and a principal for 25, 30 years. Finally retired. I think he's going to drive my mom crazy when he's at home all the time now. And even my mom worked for the Board of Education as well, so thank you to them also.
You know, I think, Hockey, you and I do a lot of education. We teach a lot of kids and a lot of students. I call them kids now, residents and medical students. It's a family history thing. My mom was on the Independent School Board, Betty Stites, for a number of years. She was vice president of the Independent School Board for, I think, 6 years. And the library at Truman High School is named after her. You know, we all need to do the best we can at putting our arms around and hugging our kids, because they need to feel safe, they need to be cared for, they need to be loved, and they need to feel healthy. And we want to thank you guys for doing that great work of taking care of them today. That's been awesome. All right, thanks for being with us today. Alexis, what's coming up tomorrow?
Tomorrow we have a powerful program on dealing with grief during the pandemic, especially when it comes to children. Many children have lost a parent or a relative to COVID. So this episode tomorrow first aired during the height of the pandemic. It included some very important ways to make sure your kids are doing okay. So we will have that encore presentation for you tomorrow morning at 8 a.m. and then we're back here live on Friday at 8 a.m. Make it a great day.
The fall sports season is here. Nearly 60% of students will take part in some high school sports this year. I'm Jessica Lovell. Coming up Friday, the role parents and students take in preventing injuries this season.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.